Yeah. So we said this. We are going to look into a 6-part program on human behavior change. So in the last class, we had tried understanding what's behavior and what is the importance of behavioral change understanding for a physiotherapist. We had a debate on that. Some of us discussed that we require a more standard set of language in order to communicate about behavior change, because it looks more of a domain of psychologists. And then what are we going to do over there? Wouldn't they be better or not? That was a discussion which Selva sir had initiated. And then we had discussed that we would require, in fact, a knowledge of how we are going to change the behavior. All right. So can anyone just recall from the last class just a bit and pieces what is a behavior?
So behavior is an action, activity or process which can be observed or measured.
Okay, right. So that's the precise definition which we had about behavior, that it's an action or a process which can be observed and measured. Okay, right? Because behavior is a very vast term. It's used in multiple fields. So in order to have a kickstart in it, we said that's the definition that's how we defined a behavior as. Right? So in this part, what we will be doing is we are going to try and understand the process of behavior change as it happens within the humans. And from that understanding, we are going to just take out what factors could be influencing it so that we can apply that across a broad spectrum of behaviors which we want to change. In continuation, in the last class, we had said that a behavior consists of whenever we are talking about behavior here, we are talking about health behavior. That is any behavior that can influence the health of a human being. And by the end of the last class, we saw that there are two kinds of behaviors. One is a good or healthy behavior, and the other one is a bad or unhealthy behavior. We took an example of obesity and behaviors related to obesity. And we saw that there could be many behaviors which could be categorized under different domains. For example, we saw having a sugary sweetened drink like a Coca-Cola or a Pepsi or something else could be something which is a habit for a person who is having obesity, and that could be one of the causes of it. We also saw that the advertisements which are being posted in the social media as well as in TV can in fact influence a child from towards these beverages and towards snacks which are not so healthy. All right. So we saw that it's multifactorial. Many things can influence a behavior. So that's where we stopped in the last class. Right? In this So the primary goal we are going to take in fighting against behavior is try and produce a behavior change. That is from a healthy behavior, from an unhealthy behavior, we want them to change towards a healthy behavior, number one. Number two, if they are having already a healthy behavior, we can strengthen the healthy behavior. or if they are having a unhealthy behavior, we can weaken it. Okay, right? So as we are trying to change, we see that a person who has to undergo a change has to undergo through a lot of steps, and then the change comes. Of course, there are people who contend this, which means that they say that no, it doesn't go through these stages, but that's fine. For us, first is understanding that there are different stages through which a behavior change occurs. So the most important thing why we need to understand about this particular one is we cannot advise a person to change his behavior, and we cannot expect the person to change in the next moment. Like, he's not exercising, you tell him you exercise, and then tomorrow he starts exercising. That doesn't happen. Of course, within our exercise therapy room, we might see that they are doing it, but that is something which is done because we are telling them to do just that. But it's not that happens all the time at other places when we are also not there. So there is a theoretical model which is called a trans theoretical model. The people who developed that model said that people do go through these phases. The phases are pre-contemplation, contemplation, preparation, action, and maintenance. So what is this pre-contemplation stage, right? Now, say for example, all of us are physiotherapists, and by default, we understand that a physiotherapist is a person who does not do exercise in the world. All the other persons are advised to do exercise by a physiotherapist, but we don't, right? So say for example, we want to start changing from not exercising to start to exercise, right? And I hope many of us would have already tried it, and some of us might have succeeded, some of us might have failed. But the first stage is called as a pre-contemplation. What's a pre-contemplation? Basically, contemplation means thinking about it. Okay, right? So, say for example, I want to start doing exercise, right? Then what happens is I just think about it. Okay, I need to do exercise, right? Or say for example, I eat out a lot, right? In the sense I have a lot of street food and other food, and I want to stop it. Then I start thinking, okay, this isn't very good for my health. It would be nice if I can stop eating the samosas and pizzas more often, right? So that is called as a contemplation, right? Pre-contemplation is a stage where I have not thought about it. Okay, right? So that's called as a pre-contemplation stage. So when we are trying to advise a person, say for example, a person is having a back pain, and we see that they are having very protective behaviors, like they are not walking fast, they are not climbing stairs. Okay, they are Jabastin.
Yes, sir, I'm on it, sir.
Okay, you're okay. So they're very protective about the back, and they're not moving. And as physiotherapists, as exercise therapists, we know that if the person is very protective and if they are not moving much, then it is in fact going to start the process of degeneration within the back region, and they might land up in more suffering than before. So patient comes to you, and you are going to look at him and tell him that you need to start exercising, you need to start walking, you need to start driving. If you're telling like that, but the patient has not thought about it, then we can assume that he is in a pre-contemplation stage. Do you understand what I mean by pre-contemplation?
Yes, sir.
Yes.
Okay. So the second stage is contemplation. Here, the person really thinks, okay, this is not good for my health. I understand. Now I will have to try and do something about it. I want to change, right? then that stage is called as a contemplation stage, right? Now, whenever we are going to try and intervene a patient, it's very important that we understand whether he's in a pre-contemplation stage or a contemplation stage. Okay, because if a person has not thought about it, then if you are going to tell him that you need to do exercise, he will hardly move to the contemplation stage. It might not, he might not start doing it. He might only start thinking about it. Okay. The next stage is a preparation stage. Okay, right? So we are all ready. We want to do exercise from tomorrow, right? So we start thinking, okay, right, I'll start doing exercise from this new year onwards. That'll be the goal for this year, okay, right? And so December 31st, we are in contemplation, and then we start thinking more about it. In this stage, what happens is the person normally starts thinking how he can do it. Okay, should I buy a treadmill tomorrow? Would that be a good investment? Can I buy a bicycle instead? Would that be good? Or shall I start wearing a pair of sneakers and then start going out, right? So that is the stage where the person moves towards the preparation part of it, okay, right? So that's called as the preparation stage, right? So he starts thinking about how he can do that, okay? That's one part of it, preparation. It's not all the part of it. Alternatively, the person might also think, I would like to start getting up tomorrow a bit early. Maybe I normally get up by 7:30. Okay, fine. Let me start getting up from tomorrow by 5 o'clock. I'll freshen myself up, maybe 5:30 to 6:30. That will be a good time where I can start doing it. This is another part of preparation. Okay, right? So the person starts planning, right? This is the next stage of behavior change, which is called as a preparation stage. Okay, right? So you're not just thinking about that you need to do an exercise or something. You start preparing yourself as to how to do, when to do, right? Where to do, with whom to do, all these stuffs. Okay, right? The next stage is the action stage, wherein a person starts doing it. Okay, right? So January 1, you have started going, right? So you've started doing the exercise 1 or 2 days. Okay, right? That's the action stage. Say, for example, we want to stop eating junk food. Okay, right? So you have not taken it on Jan 1, you have not taken it on Jan 2, you have not taken it on Jan 20th. Okay, right? So that's a stage wherein you're in an action stage, right? Things are under your control and you've started doing it. That's your action stage. And the last stage is the maintenance stage. Maintenance stage is you're not only doing it, but you're doing it very consistently and you're keeping going on with that. That is called as the maintenance stage. Okay, right? So there are 5 stages, 6 stages. People can divide the first or second stage into further 2 stages. You have different stages of change model, but this is one of the commonest models, and many of us would remember going through these different phases. Either we would have been in a pre-contemplation about something, and then suddenly we would think on one particular time that I need to start doing a particular behavior. All right. Clear. So we would have gone through each of these stages. So I think it should not be very difficult for us to recall and visualize ourselves going through the different stages. The thing we need to remember in here is 2 things. One is just because a person is contemplating about it, it doesn't automatically follow that the person is going to start preparing for that. Or for that sake, if a person has prepared, it doesn't mean that he obviously is going to be in action stage, right? He might be preparing for 1 day, 2 day. He might have thought and prepared it multiple times, but still it might not have transpired to action stage, and he might have actually forgot and gone back to it, right? So this relapse is something which can happen at any point of time, right? That's one particular thing we need to understand about the stages of change. The other one is the factors which would be the reason why we are contemplating or why we are not contemplating can be very different from the factors that will be influencing why we are taking an action or why we are not taking an action. Okay, right? So a person to we need to understand that whenever we have to change the behavior of a person, first we may need them to get into the action. That's very important. And after that, there are other factors that will in fact come and start influencing whether they are able to sustain that or not. So not necessarily a person has started doing some exercise, it's good, right? Because he might not continue that for sufficient enough long period in order to bear its fruit. For example, all of us know that if at all we need to get a cardiometabolic benefit out of an exercise, it is all the more important that we do it at least for a minimum of 6 months continuously in order for it to produce relatively permanent changes within our body and within our vascular system, and get it a change internally the system. So we need to understand it. Starting is one, but the factors which influence the starting and the factors which influence maintenance can be very different. Okay, right? So do you have any thoughts to pour in at this point of time, or would you want a clarification in something?
Yes, sir. I have one question. Am I audible to you, sir?
Sir, your voice is not audible, sir.
Yeah, are you able to hear my voice?
Yes, sir.
Yes, sir.
Yeah, so can you go ahead with your question?
Sir, I have one question.
Yeah.
If one person is in action stage,
Yeah.
and at other point he is also in pre-contemplation stage,
Okay.
is it possible? And if it is, if this condition is possible, then how we can convert that pre-contemplation state to action stage?
Yeah. First, I would like to identify you. Can you tell me your name?
Sir, sorry, I'm Dharmita.
Yeah, Dharmita.
Dharmita.
Okay. So when you tell pre-contemplation stage and the action stage,
Yes, sir.
basically you cannot be in two stages because these stages are a bit exclusive. They are not inclusive. Okay.
Okay,
So
sir.
you can have two at the same point. You might be thinking about two or three different behaviors which are very closely related, and you could be in a pre-contemplation stage about one behavior and an action stage about other behavior which is closely related to that. But you cannot be in an action stage, that is, you cannot start jogging and you cannot be thinking whether I'll go for a jogging or not.
Okay, sir. But if I will take this in relation to stroke patients,
Yeah.
like some patients will do exercises but they are not willing to do. Like they will not cooperate with us.
No, okay. So you mean they are doing the exercise, but they are not
They
doing
are
by
not willing.
themselves.
Yes, sir.
Okay, right. So whenever a person does an exercise in front of us, right, we normally think it is something which they are doing, right?
Yes, sir.
But it is not so. When you tell a person to do an exercise, he is just
Yes.
simply following a command.
Yes,
But
sir.
when you are telling about an exercise, it's a very active thing where he has to be mentally put himself in a place and he has to explore what is to be done, and he has to be trying to do it, and then he need to solve the problem. So when a person is doing an exercise, we don't call that as exercise behavior.
Okay, sir.
Okay, right? Now, when we call it as exercise behavior is when he starts doing it. Okay, right? So I sit in front of him and then I tell him, now do 10 reps of this particular exercise. And then
Yes, sir.
the next time after he completes, I tell him, now do this particular exercise, right? That
Yes, sir.
can have a benefit, but the effect will be very minimal.
Okay, sir.
So here we are talking only about active exercise. We are not talking about passive exercise. What I mean by passive exercise is not just a physically I'm doing it for the patient, but also mentally I'm doing it for the patient.
Okay, sir.
Okay, right. So here we are talking only about a very active form of it, and that's where we come with this idea. Okay.
Okay. Thank you, sir.
Any other questions? Any other thoughts?
Sir, what all the challenges can be expected in this process? Like when the person is moving from one stage to the other stage, what are the challenges?
So I think you're asking the conclusion part of it.
Okay.
We'll get into it. We'll get into it slowly. All right. Yeah. As you rightly said, sir, the challenges are different, and the way we have to approach these patients is very different. The measures we take in order to get a person from pre-contemplation to contemplation is not the strategy we will use for a person who is in contemplation whom we want to get into action. So
Okay.
you point out the challenges are very different and the reasons are very different.
Sir, I would like to give an example for this. Like I have one head injury patient. So every time he walks, he takes the support from the wall, or he takes wherever the support is there, he will try to catch. So how much ever we say, like, no, you can walk without taking support. In fact, this is more dangerous. Like you are keep on looking for a support. And he simply says that, sir, this is my fear that I will fall, so I am looking for a some supporting thing. And you are without any background, how you are telling you can walk. So he used to argue with me and say that no, I am not confident. I will not do it. So
that's a real challenge, sir. I think Sebastian can throw some inputs because he made one patient move from that wall walking to without wall walking.
Okay.
But that was one patient again. So
no, then what I understood was like it is only I wanted it. I desperately wanted him that I think that he can do it. But he has very strong, and he has very strong reason also. He openly says that when I have the fear, how can I do it? No. So then I felt that okay, I am not taking out his fear only. Then how come I will simply, just because I am a doctor, I am instructing he has to follow? No, that will not. Because this is something not taking a medication or something. So he might be
physical ability,
yeah.
right? To change it, right? We all think is challenging, but
yeah, for the person, he's he undergoes the internal process. What is happening? We are not looking into that.
Into that.
Life. Yes.
Yeah, true, sir.
Yeah.
Yeah, Jebaston, you had some question.
Yes, sir. So the question was, so you said that a factor influencing or the factors acting on why the person is in contemplating state or not in contemplating state is different from factors that is influencing why a person is in an action state or why
Yeah,
is
the other
not
state.
in
Yeah.
action state. So can you please elaborate on that, sir?
I think as we go forward, we can look into that. Should that be fine?
Yes, sir. That should work. Yes.
Right. Okay. Any other questions? Any other inputs? Okay. Right. So if not, then I'll just continue with the other part of it. Right. Before concluding. Yeah. Can you see the screen?
Yes, sir.
Right. So now, given that we have understood that we need to identify that what stage they are, there is a simple questionnaire which is called as Stages of Change Questionnaire, which can be used in order to identify it. Right? Now, this is an example which is given. All right, this is about dental care for a person who keeps getting dental caries. Kid, they start eating a lot of chocolates, ice creams, and other things, and their teeth starts getting decayed. And so the dentist's worry is just not to stop him from eating that, but also to see to that he keeps his oral hygiene very good. So this is a behavior, right, of brushing the teeth twice daily. All right. So the question runs from the you can read it from right side to left side. That's the opposite of what is given, right? So if the person does not brush the teeth twice daily, then the behavior is not there, right? No. Then the simple question is, do you intend to start brushing your teeth twice a day? If the answer is no, I don't think I have not thought about it, or no, then then the person is said to be in pre-contemplation stage. If they say, yeah, I do think I need to start doing it, but within the next 6 months or so, right? If he thinks, then they are in contemplation stage. All right. And when we ask a question, okay, you want to do it, but how do you want to do it, right? Then they are very concrete in telling that, see, I'm going to start from the next week or so. I'm going to start doing it in the morning, which I normally do, and along with that, every time after I eat before going to bed, I would start doing it. That's preparation stage, right? If they have already started doing, but for less than 6 months, in this particular behavior, they have defined 6 months as a time. For certain behavior, 3 months could be sufficient. For certain behavior, even 6 months could not be sufficient. We can also extend it to 9 months. It depends on the type of behavior and the type of change we expect it to bring in. Okay. So if how long have you been brushing your teeth twice a day? For less than 6 months, if he says, yeah, for the past 1 or 2 months I've been doing it, then he's in action stage. If they have been doing regularly as a habit, it has become, then the person is in maintenance stage. So a set of 3 questions, 3 or 4 questions could easily guide us to identify in which stage the person is. But as with the problem with many of the questioners is really when a person is answering your question, his state of mind influences the results. So if he has not thought very deeply into it and is very superficially answering this question, then it wouldn't work out. But we can repeat the questionnaire at 2 or 3 points of time in order to identify this. And for the action and maintenance stage, we can have an additional proof from their family members whether they are doing it or not. And that could help us to delineate in which stage the person is. Okay, right? So as a homework, what I would do is you can all think about a set of 4 or 5 behaviors which you personally desperately want to change in yourself, or it could be in your patient. You are going to have say 2 behaviors which you want to change in your patient. Sorry, you can ask these questions to your patients and yourself, and you can ascertain in which stage you are in. Okay, so that would be good for us to understand what stage of behavior change we all are in. Okay, right. Okay, I'm sorry, I'm just recovering from fever. Okay, right. So I've spoken about this. All right, and very briefly, before this would be the last part of it. So we said that previously that behaviors arise because of multiple factors. So when we are looking into a behavior, it could be because of a person is having a capability to do it. So every one of us know that if at all a behavior should be happening or a behavior change has to happen, then first is we need to have the ability. As Silva sir rightly pointed out, his patient is walking, holding onto the wall, and he doesn't walk without that. So there we require 2 things. One is, why is he walking, holding onto the wall? Is it because he is only afraid of it? Or is it that he does not have the capacity? He might be having a very, very poor score on a Berg balance scale or a dynamic gait index, which can tell that he really has, he does not have the ability to really walk without support.
हाँ तो मैं वही बोल रही ना उसमें वो और उसमें कुछ चीजें.
Okay, right. So first is the capability should be there for any behavior to happen. Okay, that's the first part. So when we look into capability, there are 2 parts of capability. One is called as physical capability. The example which we discussed, right? That the person has a low score on a Berg balance scale or a dynamic gait index, which tells that he does not have a physical ability to execute that. Right? The other one is mental ability. A person should be capable of understanding what is to be done for a particular behavior to happen, right? So an old lady is there and you want her to do an exercise, right? But her mind is in a state of confusion or agitation where she does not seem to think about how to go ahead about this particular thing. If she does not have that mental ability, then she will not be able to exhibit the behavior. All right. So when we talk about ability, the first factor which can influence a behavior, it involves both a physical capability as well as a mental capability. Okay. Do you understand this?
Yes, sir.
Okay. So in order to exercise, can you just tell about what could be the capability that we require in order to do exercise?
Sir, can you come again?
Yeah, when we talk about aerobic exercise, when we have to start doing it, right? Can you tell me what is the physical capability that we really require in order to engage in that behavior? or the other way around.
Endurance, sir.
No, that's something which comes after the behavior is realized. That is, the person starts executing it. After that, we require an endurance. Okay, right? But now we are talking about a behavior to come.
Yeah.
Okay, right? So,
Sir, concentration and attention power of the person.
no. Sorry. Concentration and attention are necessary in order to do that. Yes, true. If a person is not having that, then it's difficult to do. Okay, I'll put the question the other way around. What would prevent a person from, what would make it dangerous for a person to do exercise?
Sir, MMRC scale grading 2, 3, 4.
What is that?
Sir, dyspneic scale. If the person is doing extra strenuous activity, he won't be able to.
Okay, a person with a potential inability to do it, right, or he's contraindicated for doing it, right, then it is not possible. It's not advisable in him, right? Yeah. So a person who, if he has to do the exercise, he should have that capability. Okay, right? So when a person is starting to do an exercise, when we want him to start doing an exercise, but the patient is thinking that he will have to run a marathon tomorrow, right? Then that's not going to be possible. So he cannot straight away go on to 10 kilometers or 15 kilometers aerobic exercise, right? So that's what we mean by the capability. Okay, right? Now, let's assume that a person has a mental capability, is oriented, he knows what is to be done, he going on the road is safer for him, he can make a judgment call as to whether he has to cross and run or he has to do that. He has all the mental capability. He also has a physical capability, right? But then if the person is not motivated enough, then he will not be able to, then the behavior will not come out, right? So the second factor is motivation, right? When we talk about motivation, there are two types of motivation. One is called as a reflective motivation. Okay, right? The other one is called as a automatic motivation. Right? So reflective motivation is one where the person consciously makes a decision about why he wants to do it. He knows that if he doesn't do this exercise today, he's going to land up in ill health, and that's why he desperately wants to do the exercise. That's a reflective motivation. He thinks and he does it. But at the same time, we should also understand that a person, whenever he wants to do something, right, he might be easily getting carried away by other things. Okay, right? So that is called as an automatic motivation. Okay, right? For example, right, this is a prime theory of motivation. You can see here that within our mind, right, whenever we have decided, we think about it. That's called as a plans. Okay, right? That's the intention. And then we evaluate our plans as to why, how to do it and what to do it and everything. That's your evaluation about it, right? But then what happens is you're motivated enough to do that particular activity or the behavior, but then suddenly you start seeing that you have an alternate option which also props up in your mind at that point of time. For example, I want to start doing an activity. I want to start exercising. Okay? I want to start exercising. Morning, I'm getting up, I'm opening my eyes, right? My alarm has gone on and I'm just opening my eyes, right? And then I see that the sun has not come out, right? And I see around all people are sleeping, right? And then I just start thinking, okay, shall I just little bit more time, let a little bit of more light come in? Maybe that's good to go. Now it's slightly cold. It's December, it's very cold. Why not the other one, right? So now this starts coming in whenever we start thinking about, okay, we have to do that. Yeah. And we are walking on the road. We want to avoid the junk food, or we are going with our friends and you have decided, okay, I'm going to take really, really healthy food. And then you sit there and then you see that the person who is sitting next to us has a tasty food. And he really tells that, wow, I've been waiting for this and now I'm really going to enjoy it. Why don't you join me, right? That particular moment, we start thinking, okay, chalta hai, let's try one day, it's okay, right? So this is something which develops inside our mind. These are called as impulses or the urges we have. It starts coming in, right? And then what it starts taking it over and it goes away, right? So that's called as your automatic motivation playing. Okay, right? So do you understand the difference between a reflective and automatic motivation? Yeah. Okay, right. So we saw that we require a capability, and a person who is having a capability should be motivated sufficiently for the behavior to come in. The last factor which is going to influence your behavior is opportunity, right? So a person is having a capability, that is, he can do that, he's sufficiently motivated, but he does not have that opportunity, right? Then it becomes difficult. Now, when we talk about opportunity, again, there are two components to it. One is the physical opportunity or the environmental opportunity, right? So you want to go for a aerobic exercise and you have decided that you want to go for cycling, right? Because the place which is immediately outside is not good and you want to go for a little bit more distance and you have decided, but then you don't have sufficient funds to purchase your bicycle, then you don't have a opportunity, right? Of course, with aerobic exercise, it's very simple. We can uh, we can do a jogging, but the preferences are preferences. You start in August month and you want to go for your jogging and everything, and you start seeing that it's raining all the time. The park in which you want to walk is muddy pathway and it doesn't allow you to go for it. So then the opportunity is not there. So this is a physical opportunity. Not only physical opportunity, social opportunity should also be there, right? So basically a person is smoking, is alcoholic, right? But he doesn't want to lose his friendship. He wants always to be with his friends who have that habit and who have not stopped drinking or things like that. Then it becomes very difficult, right? So opportunity is physical and social opportunity. So to recap again, if a behavior has to happen, then there are three things which are needed. First one is capability, both mental and physical. Second is motivation, both reflective, that is, you have given a lot of thought to it and you're motivated towards it, as well as automatic motivation, a process which goes on our brain. And lastly, the opportunity part of it, which is a physical as well as the social opportunity. So for any behavior to arise, we require all these three things. Okay. All right, so we will stop here. That completes the outline of the stages and the causes of a behavior. So if you have any questions or if you have any points, you can just explain that.
Sir, you have said three things, capability, then motivation and opportunity. So suppose if I'm training a stroke patient, stair climbing I'm training.
Yeah.
So the patient is not having the capability to climb down and up.
Okay.
So what I am trying to do is I am giving the opportunity to make him to do it. I'm exposing him to that situation, and I'm giving the motivation. So what the motivation I have given, the patient finds the fear to step down and step up. So he is trying to hold me, or he is trying to hold the trails. So what I'm trying to say to him is, what I said to him is, you don't worry about the outcome, whether you are failing or you are successful in that activity. So first you try it and do it. Then we will see if it is if it is failure or going to fall. I am there to support you. I won't make you to fall. So that confident I'm giving to him. So here the patient is not having the capability. We can't able to say that the patient will do it.
No, the capability, you are evaluating him and you have evaluated, you're thinking that he does have the capability, right?
No, when we are making the patient to exposed to that situation, we can't say that the patient will have the capability.
Okay, now we need to understand one thing very clearly. Here we are not talking about giving an exercise. So what I mean by that is when you're trying to give, what you're telling is about giving an exercise. But when I'm telling a behavior change, here it is not this small thing that whether he's doing it or not doing it. That's the work of a physiotherapist to evaluate whether he will have it and set the intensity or the challenge in such a way that he can start with. Okay, right? Here we are talking about a long-term process where you are not there and the person has to climb stairs at his home. And you want him to imbibe that daily. He has to do it as a routine practice, right? But if he's not doing it, then the question comes here. Subbu sir?
Sir?
Yep. So those are two different things.
So in this, we are not trying to change the behavior of a patient when we are.
No, you're trying to give an exercise. That's different. Behavior is individualistic. It is what he wants to do.
But it is initiated by a stimuli, you are saying, no, sir, when you're giving the definition.
Yes, it is initiated by a stimuli, but not this stimuli. Because when you are telling him to do an exercise, it is you are telling him to do an exercise. That's it. You still do not know whether he is in which stage, whether he is in pre-contemplation stage or he is in contemplation stage. You're not said about it, right? You're trying to make him do. That is different. Okay. You want him to do it. That is different. You're making him do it is different.
If he is doing it frequently, does the behavior won't be changing, sir, in the future?
Obviously, it might change, but whether the question here is whether does he want to do it or he doesn't want to do it.
So
when I say he wants to do it, when I say he wants to do it, right, it is really from inside. It should be coming.
Okay.
Right. So here we are not doing a conditioning training like Pavlov's dog. We are not conditioning him. He does it, and then it becomes a habit, right? But we are looking at it from the different angle.
Okay.
Yeah. Any other questions or inputs?
Sir.
Yeah.
Sir, am I audible?
Yeah, you're audible.
Sir, sir, from a physiotherapy aspect, like how much can we contribute in a patient or in an individual to develop a behavior? Like, is it only very much individual, or we can also take a part, like we can motivate them, or is it like it has to like 100% come from the individual, the behavior like development?
Yeah, there are numerous behaviors which will be there, which are good, but what is essential can be very few. So our role starts in whether the behavior which we are choosing is a very important one, and will it help him? That is one part. We cannot talk at this point of time about changing every unhealthy behavior in a person. Okay, right? So this is just a context which I'm telling. Okay, right? And number two, coming to your question, should I what should I change, right? How, I'm not getting it. Can you come again?
So like how much is my like now as a physiotherapist's role in like
Yeah,
to build that change like behavior? Like is it
behavior.
totally from an individual aspect to like to make my own behavior, or like someone else can also contribute to build up that behavior?
Yeah. Now, what happens is we said that the behavior can be influenced by multiple factors. So some of the factors might require that it needs to personally come from the patient. Some of it might require that there is a partnership between the patient and the therapist, and both of them sit together and bring things. Okay, right? Or it could not depend on the therapist or the patient, or externally someone's help might be required. Now, this question cannot be answered unless and until we are capable of identifying why that behavior is actually not coming. So then only it will be possible for us to know what is the role that we need to play, and what is the role that we may be able to play in that particular thing, right? But if your question is should I do that, right? Then definitely, if you want the outcome, and if that particular behavior is unhealthy and it is not helping in bringing that outcome, then it's the sole responsibility of the physiotherapist to ensure that the behavior change comes.
Okay, got it.
Sir, also some individual personalities can come into play, no, sir? Like some patient will be, like they're determined not to do, or I mean, there is no actually need for them to do, sort of thing. Like if they perceive it in that way, then that would be like his choice. Like he doesn't want to do. Like we had one kid who was not doing anything, left side paralysis following a neurosurgical procedure. So then, by our instruction, nothing was going on. Then, when we started talking outside this therapy environment about her interest and her friends, and what she likes to do, is there any festival or function coming in the family? Then we could start seeing some. That's what the dropouts thing developed. And then we thought that okay, some her uncle marriage is coming, like that she told. Then why don't you prepare for that? Why don't you start doing a shopping for that? Why don't you go? You take some break. I mean, go out of the hospital and do some purchase and come. So then she started showing a lot of response and showing the willingness to do the exercise, or even she dramatically improved. Even we were surprised, like until then she was not moving the limb, thinking we are thinking it's a weakness. But then the way she responded, we thought that just maybe simply doesn't want to do it, because she
Yeah.
was not having a good reason for no to get all right or something.
Yeah. So from pre-contemplation, you have moved them to the contemplation, and
Yeah.
then the processes started kicking in one after the other, and then it started coming.
Yes, sir. That's
Yes.
why someone asked, like, what therapist can do about it. Yeah. So now, the identifying their, their interest also sometimes will help.
Yeah.
According to the, I mean, if it's child means what is their liking and that way.
Hmm. Yeah. That's so. Okay. Right.
We'll stop.
Yeah.
So
Yeah.
So you told about these three factors that are contributing, right? Like capability, motivation, and opportunity. And every topic has two, like mental and physical, reflective, and so there has to be some quantitative measure to quantify these things, right? So if a person is having physical capability, something has to be there, or a mental capability. How much is it, so that we know and then we grade it? Is there something, or do we do it as descriptive one?
Yeah. Now, it's very easy to quantify it rather than qualify it. And the challenge is in qualification, not in qualifying, not in quantification. Because you can grade a physical ability. The issue is not that. But then whether does it really play a role in the behavior exhibiting or not exhibiting becomes our more important question. So we have three components in it. One is, does it or does it not? So we require a tool in order to discriminate that. That's number one. Number two is, when multiple factors are playing a role, how do they interact with each other? Some factor are called as mediators. That is, without factor, say for example, you have factor A, B, and C, all three put together will lead to the behavior, right? Factor B might be a mediator. That is, if you take out that factor, then other two factor alone may not be able to bring out the behavior. Or it could be a moderator, in the sense A and C together can produce a behavior, but B is required in at least a sufficient strength in order to support it. Okay, right? So that's called as a moderator. Or rather, B can only increase or decrease the intensity of behavior, but A and C are sufficient enough to carry out the behavior. Then we call that as a moderator. So whether it's a mediator or moderator, that's the second question that we need to bring in. Then last is the quantification, how much it is and things like that. So when it comes to behavioral science, it's more difficult for us to identify whether that factor is influencing or not, and how do they interrelate with each other. So that becomes more challenging. Quantification could be a very, very simple process, right? The level of fear. We have a fear avoidance belief questionnaire. We have other things which can very easily quantify it. So the challenge is not to quantify, but to qualify. That's my take on that.
Sir, can we understand the same with absolute and relative principle? Like some factors might be absolutely not contributing. So if it's like absolutely cannot gain any behavior, or some can give relative result to the behavior.
Yes, yeah, absolute and relative. But when you tell a moderator, it just changes the magnitude of the output. Okay, right?
Oh,
so yeah, there's a mild difference between absolute and mediator, yes. But relative and moderator is not the same.
Sir, I get it.
Yeah. Any further questions?
Sir, what about constraint-induced movement therapy, sir?
Yeah, constraint movement therapy is basically a 1970s, 80s idea, Pavlovian, and idea of how to force a person to do a behavior. So I don't think it is really something which we need to. We have moved ahead. The entire science of what motivates a person is very different. And I think we had lengthy discussions on this, Subbu, they have invented constraint-induced movement therapy to be applied on monkeys. And so we cannot assume humans to be monkeys. So,
but still now in upper limb rehabilitation, we are having better evidence on CIMT only, no, sir?
No, the thing is, that's where we need to be very clearly rule out between the behavior of it being carried forward after 6 months or 1 year is very different from that which is carried after 15 days of constrained use movement therapy. So 15 days of constraint, the patient knows that, okay, after 15 days, I'm just going to throw it out. And after that, I'm going to do it. But the long-term carryover studies are very, very minimal. 6 months and 1 year follow-up studies where the person is consistently using his affected side, the studies are very less. We have all short-term studies. Most of the constrained use movement therapy studies, as you would have reviewed for yourself, would be maximum of 15 days. And there is a behavioral contract where both of them sign that I'll be doing it. Okay, right? So contracts can work very, very less. So long-term, we really don't have the translation. And more importantly, for people who are having very poor ability, CIMT is again not very useful. So the capability part of it, we saw that a person should have some capability of finger extension in order to use it. That's how it is, right? So for a person who is having less capability, CIMT doesn't work out, doesn't help any extent. So of course, the initial papers, the first few papers, if you see, they have in fact tried attempting it, and they have said that the patients are not motivated. The specific sentence comes in that article, Edward Tobbs' article.
It is a low, it is more disability patients.
Yes, but when you tell a person is able to open the finger, he has recovered completely. That's what we know, right?
Yes, yes.
Yeah. Okay. Any other questions?
Sir,
Yeah.
Sir, I would ask one more, like the behavior of a person that we cannot identify that in a particular day or in a particular environment. To understand that, we have to take the person to a different, like if there is caretakers with the patient may not open up. The patient may not tell what he really wants or what he really wants to do, or in a particular setup, when it is in a closed room, we cannot identify what he really wants to, what is really behavior. So it is a very long process that we should be taking care of. Like we cannot identify it in a 1 day or a 1 month also. Like if that day is a bad for the person, he may not tell or show his the original behavior. He may be hiding something. So it will take actually a very long duration of the patient for us to identify his proper behavior.
A part of it, what you're saying is right. But it's whenever we evaluate a patient, we have this habit of pre-test and post-test, right? So we evaluate on 1 day, we assess their ability, and then we close it off, right? So that's how we have been trained in physiotherapy to do it. But as you rightly said, when you are telling a behavior, the monitoring is not on 1 day. The monitoring is going to be over a period of time. Okay, right? Whether he's showing that or not. And as you rightly said, environment might play a role, but the question is not, but there is one part to it, which is if you are telling the environment is playing a role, him not demonstrating in that environment is it's in itself a unhealthy behavior, right? So in fact, to make him demonstrate in that could be our goal for behavior change. Okay, right? But it doesn't require too much time to evaluate. Some behaviors we can evaluate within a week's time, some behaviors within 15 days time. I think all the opportunities are available to it. So we cannot monitor him 24/7 in order to conclude about something. When he doesn't demonstrate a particular behavior in a particular place, then that's it. He doesn't demonstrate, that's it.
So we are not trying to find out these behaviors, right? We are trying to find out the factors that are causing these behavior.
The factors that are causing it, right? even for that, right, we have methods to identify that. Okay. Right, and the factor might be hidden inside and he might not actually, right? But if he's not capable of showing it, then we need to tell it is not available or it's not accessible at the correct time. That's it. So either for the factors or for the behavior, it doesn't require us to monitor them for a very long period, but it cannot be evaluated on one particular day, sitting across a table and then asking questions and then finding out it's not going to work.
Sir, I'm having one doubt, sir. Last doubt I'll ask, sir.
Yeah.
Sir, the patient is having he's in that pre-planned stage. I want to do this. Suppose we have seen Nitin Kumar, we have seen. He wants to improve his upper limb function, but his physical capabilities is not allowing him to do. Still now he is not using that hand, almost 1.5 years over. So but he wants to, he's having his behavior is he wants to do it and he wants to improve it. But because of the physical...
I like to have some clear-cut differentiation. Okay, right? One is the for others who don't understand the context, is a patient who wants to improve his upper limb. He wants to do exercise. He can cooperate for that. Okay, right? But he does not do that. Okay, right? So this is a patient. So Subbu, point number one is, one second, I'll just, right? Point number one is the outcome is the improvement in the arm. Okay. So that's called as the outcome. Okay. 2 is the behavior. Behavior is, in order to achieve that outcome, what all he needs to do for himself, both inside the therapy session as well as outside the therapy session, is called as the behavior. Okay, right? And in order to exhibit this behavior, we tell that there are 3 things which are required: capability, opportunity, and motivation. So those are factors influencing the behavior. Okay. And of the factors which are influencing the behavior, one is needs. A person actually requires that. Without that, he cannot live. That is his need. Right? The other one is his wants. What is his wants is his desire. Okay, right? He needs it, but his desire to do that. Okay, right? The desire is not about the outcome. The desire is not about he wants his upper limb. That is something which none of us can work on. Okay, right? Here it is about the wants, what he desires about doing the behavior by himself. Okay, right? So these are 4 different terminologies. Outcome is different, behavior is different, factors influencing behavior is different. And within that, we have wants and needs. That's the motivation part. But apart from that, he has that physical ability. That is, whether the tracks are fine or not, for it to come out is a physical ability. So what we are actually, what we should be clear about is, what is his wants for what? He wants to do exercise. He wants to do exercise at that particular intensity in that particular manner. That is what we are looking at. Okay, right? So that's entirely different from he might desire tomorrow to just use his arm and things like that. That is something different. Subbu, did I make my point?
Sir.
Yeah. No, you want to throw in on that? You can still throw in on that. But okay. Yeah, sure. Okay. Thank you all for patient listening. We will, so for this month, we are closing. So we had looked into what is behavior and what is behavior change. And in the next month, we said about the 3 factors. We'll be looking into the 3 factors in much detail. And more scientifically, we'll be looking into what is the precise variables that influence it, how to identify such variables, and how to pin them down so that we can intervene the patient at multiple levels. So that would be the thing for the next month. We will again be joining for behavior change portion of it in the 3rd week of February for 2 sessions, Tuesday and Thursday nights, we'll be joining. So thank you all for joining, and please keep coming, and please keep interacting. It's more important that you all start opening up and we all start discussing more about it so that we are more clearer in what we are talking about. Okay. Thank you so much for joining. I'll stop recording and I'll end the meeting for today. Thank you.
Thank you, sir.